It addresses both very directly, which is really exciting. So wait time essentially goes away. So in a traditional fee-for-service practice, the name of the game is volume. In general, if you look around the country, probably somewhere between 25 and 30 patients per day is the typical volume that a primary care provider tries to uphold in order to generate enough revenue to keep the lights on. In direct primary care, volume is not the name of the game. Quality, relationships, experience are the name of the game. So I don't have to see 25 to 30 patients in order to keep the lights on. And as a result, really kind of the need for me to have a waiting room full of folks so that every time I come out of one room, I go into the next room and continue to generate revenue goes away. So that one is definitely directly addressed, and it's just a striking difference. Our kind of waiting room, if you will, in my practice is quite tiny. We have 4 chairs, I think, because it's just generally not needed. People come for their appointment time and they go straight into the room. We have their appointment and they head out, and there are people kind of in a line waiting for 45 minutes just to see us following that. So that's really nice. As it relates to accessibility, those are closely linked. And so really the accessibility to the direct primary care physician is built around a much better consumer experience. So virtual primary care has been built in, virtual care, telemedicine, there are different terms for this, has been built into the majority of direct primary care practices since well before COVID. So in our practice, 60% of the care we delivered was virtual prior to COVID, and that's just where the world is. So making that accessibility in a virtual tech-enabled way is definitely central in direct primary care. And then the second is because we don't have to see so much volume in a day, the majority of direct primary care providers and clinics have same day and next day availability the majority of the time for acute issues that come up. So the accessibility is also addressed.